So hi, this is Dr. Jim Anderson from Anderson Podiatry Center and Anderson Center for Regenerative Medicine. And I'm here with Richard, who's had quite a bit of success with his heel pain, his plantar fasciitis. And his story starts a while ago. It's gone on for quite a while. It was in the spring of last year, I think about March.
Yes.
You know, it's about a year ago. Because he came in as a well-established patient. He's been coming in here for years and had orthotics already, which is a common thing that's used for plantar fasciitis. But then I'll probably let him take over from there and say what happened when you came in last spring. What treatments did we then recommend?
Yes, last spring I had a flare-up with plantar fasciitis, so I came in and did the laser treatment initially on the right heel in March-ish of 2019, and that resolved the issue for a bit, but then we got into summer and it recurred again. So in August of 2019, did stem cell injection. And since then, it's completely resolved.
The right side's been really good. And then that's on the right side.
Correct.
Right side laser preceded stem cell, and you've not had to have any after on the right.
Correct.
And then on the left, though, you had it. Didn't you have it last year?
I did too. It felt left out, so it acted up.
So it worked quite a long time.
Yes. So on the left, it flared up in about May of last year.
Right.
So we did laser treatment, and that brought relief into the fall and actually to the beginning of this year.
Right.
And then it acted up again, so we decided to.
So 2 rounds of laser on the left.
Yes.
And on the right, 1 round, and then also stem cell.
Correct.
To augment. Okay.
Yeah.
Great story. And so, I mean, how long had you had it before you came in? Do you remember?
On the left or right?
On the right.
On the right. Probably by the time I got in here in March, that it had acted up the beginning of 2019.
Okay.
And got to the point where it was uncomfortable to walk.
Yeah, so a few months maybe.
Yeah.
Yeah, okay. And everything's going really good. I mean, you're able to do things that you want to do and get around. And what weren't you able to do before? Is it pretty
it was
hard to walk?
First of all, hard to walk, and then putting any pressure on, you know, walking any distance. Even exercising was a problem because you use your feet.
Do you exercise that much, or go out for walks, or
when the weather's
okay? Okay. He's saying that because we've had a kind of a interesting winter, I guess, haven't we?
Correct.
So anyway, that's very good because it's interesting. His story's interesting because podiatrists used orthotics for decades, you know, to help with plantar fascia. Because with plantar fasciitis, we're trying to reduce the pulling action of the fascia from the heel. But for people watching, understand that the stem cell actually helps repair the damage that's been brought onto the fascia. Stem cell does that, and also the laser. So you're really doing something to help regenerate the fascia. And the fascia is not inflamed, which is another video that people may want to watch. It's really a breakdown of the fascia that's happening. The more we understand about it, it's not as much of an inflammatory problem as a degenerating problem. So anyway, he's been a really loyal patient here for many years. I appreciate him taking the time to share with us what happened and how he's gotten relief here at our clinic. So if you wouldn't mind, I'd ask that you're watching this to comment, and please consider subscribing. Just press on the subscribe button. Thank you for watching.